Claudia, you made it. Checking for everybody else to join.
Did you see Victoria's text?
No, I didn't see it. Oh, I did. I sent it to everybody. Let me try it to... I could send it. Oh, you know what? I just sent it to the COVID response team. All right, everybody's going to get a double invite. Okay. We have a couple of people joining live. We're going to start as soon as we get the rest of the team on. We've been kind of playing musical chairs with things this morning. So much stuff going on and things to do to catch up with. So we're just going to wait for everybody to join so that we can get started. Hope everybody is having a good Thursday morning. Come on. There people are. There's LaDawn. Good morning, Lynn.
Morning, Darylyn.
We are loading up, getting everybody on. LaDawn, welcome. Victoria, good morning. It's a little weird, again, as the COVID challenges start to increase. We're going to be sitting here in our own separate offices and not sitting in the same room, and it seemed a little bit odd, but it's the cost of doing business and the environment we work in right now. And hopefully, um, you all out there are doing okay, doing well, not being struck with this new um, subvariant that's kind of causing us problems here, which we'll talk about here in a second. Oops. Is Claudia still available? Or sorry, Velma still available? Or is she busy? I know she was texting somebody here a little while ago, so.
I don't know.
Well, when she's available, we'll just include her. But for now, I think we're going to get started here in a second. And there's Lenora. And Raylene. Looks like we're going to have almost the entire crew here. I hear the doorbell ringing, so that means Thelma's still answering the doorbell. So we're just going to get started. So, good morning, everybody. Thank you for joining us here for our July 7th weekly Health and Human Services and COVID-19 update. My name is Troy, Health and Human Services Director, and we have our team members here. We have Claudia Lente, part of the COVID response team, LaDon Yazi, part of the COVID response team, Raylene Martinez, part of the COVID response team, and we have Victoria, our Healthy Kids, Healthy Communities Coordinator, and Lenora Arieta, who is our ICWA Family Advocate. We're missing two today for various reasons, but we're going to go ahead and start without them. So, like you all know, we do a weekly update here for Health and Human Services and for the COVID response team. We always start with the COVID update because I think that's where everybody is most concerned and worried and curious about what's going on in the community. And unfortunately, we have updates that are not very nice, but we are still navigating it. We're having quite a few tests that are going on in the community. There is, and if you've heard the blast, you know that there's quite a bit of community spread of the virus within the Pueblo, in the village. So here are our current numbers as of this morning. We have 15 active cases with a total of 266 cases since the beginning of the pandemic. And I think that what's really interesting and curious that is we want to make sure everybody understands is that since 4th of July, we've had about 7 new cases. And I think a lot of that is coming from a lot of the gatherings that took place over the 4th of July weekend. But even prior to that, we had quite a few cases coming in that are related to community spread, folks in the community that are gathering amongst themselves and spreading and contracting the virus. What has been identified as the potential culprit of this major spike in cases is that the Omicron variant, as we all know, has mutated multiple times. I think the last time we updated, it was the BA 2.12. That was the issue that was causing a large spike in cases. And now it's the BA 5 Omicron subvariant, which is making up about 70% of the COVID cases in the United States. the unfortunate reality is that BA5, well, let's back up a little bit. BA 2.12 was about 40% more contagious than the original strain. BA5 is twice as contagious as that. And what is happening with that is that BA5 has now been considered the subvariant that is most likely to avoid any types of protections from either vaccines or prior infection. So whether you've been infected with COVID prior or you have a vaccine against COVID, the protections from either are a lot less with this new variant because of its level of contagiousness, and also because of how it's mutated on the spike variant of the virus. It's actually invading human cells a lot easier than the previous strains of either Omicron or even Delta. Now, it is not, they're not saying that the Omicron, this BA5 is any more deadly or is making anyone more sick, but that is something that's unknown at this time, but it is definitely more contagious. People are coming in contact with the virus for for shorter periods of time and contracting the virus. What we used to know as the Omicron variant and how it was spread is changing and has changed. One of the things that we do need to recognize is that we look at the Omicron variant from before. When it first came out, there was an average of 5 days that the virus is staying in the system, in your system once you get it, and it was pretty reliable. Between 5 and 6 days, the virus has cleared your system, and you're now testing negative after initially testing positive. And the symptoms would usually show 1 to 2 days prior to your positive test. Well, that has changed dramatically. The symptoms could be showing between 3 and 4 days prior to you testing, and your test is still technically showing negative, which is a problem, right? Because if you're showing symptoms, that means you're contagious. But your tests are not necessarily picking up this new variant as well as it used to with the other variants, and it's staying in the system for somewhere between 7 and 12 days, which is a lot longer than the 5 to 6 days of the original Omicron variant. So people are contagious longer, they're sick longer, and the test out process that we have is about 50% accurate. It's not 50% accurate. It's 50% of the people that come in and test out after 5 days are still positive. Unlike before, it was pretty reliable after 5 days. You come in and test after 5 days and your test was negative. So BA5 is creating some challenges, not just for testing, not just for symptom identification, but it's also, making challenges as far as social distancing and how we are going to have to start planning our isolation periods and quarantine periods after exposure and positive tests. So there has not been a report from the local testing sites about which variant that we're dealing with here in the local area. The last time we saw a report, the BA2 was the one that was common in this area. But because people are testing with home tests now, and they aren't going to the PCR testing sites such as Buffalo Thunder and the college, there aren't a lot of people's samples that are being sequenced to determine which variant is here. But we are looking at it from statistics. The state of New Mexico, as well as the rest of the United States, is averaging about 60 to 70% of the cases are BA5 variant, and about 17 to 20% are the BA4 variant. So the BA2, which was the one that was dominant before, is no longer dominant, and we are facing a new subvariant. One of the good news pieces of good news about this is that it's still Omicron. I think this is a pretty long period of time that it has not mutated to a different variant altogether. These are all subvariants of the Omicron variant. So hopefully that is going to be a benefit because we'll be able to catch up to, treatments and vaccinations and things like that. So that is the numbers update for our COVID situation here in the community. So I'm going to pause for a second and allow any member of the team or anyone who might have questions to add something to that if they think they need to, and then we'll move on to the conversation around vaccines. Doesn't look like anybody has anything.
No, I don't think I have anything to add. Just that, just keep your mask on. Be cautious when you're traveling, and continue to just be safe. That's really one of the key topics we've been discussing most of the time we've been on the air, is just explaining how important it is to be aware of your surroundings and to continue washing your hands, social distancing. We have the supplies at the Health and Human Service Center. We were giving out sanitizers, hand soap, and masks. If you need them, reach out. We're available.
Thanks, LaDawn. I did want to also talk about real quick about the symptoms that are associated with the new variants that are out. They are pretty similar to the majority of the other Omicron and Delta and the Alpha variants from the beginning of the pandemic, with the exception of the majority of people who are testing positive for COVID now, they are not losing their taste and smell, and they are not having fevers. So one of those two telltale signs that used to tell you right away that this must be COVID it's not very common anymore. And some people who are losing their taste and smell, they're not losing both. They're losing just taste or they're losing just smell. So the temperature checks and things like that we used to do at the beginning of the pandemic are not going to be a good sign for identifying COVID. In fact, if you're doing temperature checks, you're probably going to catch somebody who has the flu before you catch somebody who has COVID. So, most people that are coming in for testing or reporting their positive tests, they either have symptoms that are similar to that of a sinus infection or allergies or a slight congestion, like a light head cold. There are people that are still having difficulties with oxygen concentration. So it is still affecting the lungs in the way that we breathe. So that is still something that makes this virus still dangerous. But most of the folks that are coming in, they're not coming in with severe illness or severe symptoms. They're coming in with mild to moderate symptoms. So because of that, if you are a person who has an underlying condition or you've been identified as high risk since the beginning of the pandemic, I wanted to make sure we remind everybody that there are treatments that are available that can help prevent serious illness from COVID if you take it within the first 5 days of contracting, the first 5 days of when your symptoms start. The Paxlovid is the one that is given out the most, and currently it is available through IHS. It's also available in many of the primary care clinics in the area. Basically, it's a 5-day supply of pills that you take, one in the morning, one at night. And what it does is it reduces the risk of you developing any serious illness as a result of testing positive for COVID if you have what's considered a high-risk medical condition or are immunocompromised and you have light to moderate symptoms. So if you test positive for COVID, you want to, within the first 5 days of having symptoms or even first 5 days of testing positive, you want to contact your primary care provider, call the COVID hotline at IHS at the Santa Fe Service Unit, and notify them so that they can either call you in a prescription or get you set up to let you know if you need to get the prescription or not. Because even though that most people are having light to moderate symptoms and it's just appearing like allergies, sinus infections, and head colds, you don't want to be that person if you are if you do have an immunocompromising condition, or you're taking a medication that lowers your immunities, or you are considered high risk, to not have that in your system to help to prevent the advanced stages of a severe COVID infection. So wanted to throw that out there to make sure everybody knows about it. And as we start having more spikes in COVID cases, we want to revisit the conversation about vaccines and boosters. Most people in the community can say that they've been fully vaccinated, but they're not necessarily sure what fully vaccinated means. What fully vaccinated means at the beginning of the pandemic, when the vaccines first came out, was that you got your primary series of either the Pfizer vaccine, the Moderna vaccine, which was the first two, the primary and the original booster, or the single dose of the Johnson & Johnson vaccine. Well, as you have probably read or heard, there are a number of additional booster shots that are available for folks, because after about 5 to 6 months of being vaccinated, whether it's a booster or the original series, the immunities that you have produced from that vaccination will start to wane, which means your protection starts to decrease. No, we don't want to have to hear about that and say, well, why do I have to get another shot? Well, this is the times that we live in. COVID is not an easy disease to navigate, and it's constantly mutating. So we need to make sure that we have the best protections possible, not just for ourselves, but for our families. So if you are actually, let me find the chart, because it even gets confusing sometimes to try to explain it to when you're having conversations. So I'd rather have a visual of the vaccines and what it looks like. But in the meantime, LaDon or anyone else, if you want to talk about some of the things that we're seeing and hearing from community members who have had symptoms, people might want to hear about that.
I just wanted to add to the symptoms of individuals that are testing positive are also sore throats and headaches. So just to add to Troy's information he presented.
With some of the symptoms that I've been hearing about, I've been hearing about very mild body ache, fatigue, a little bit like of a scratchy throat or itchy throat. I'm not sure if it's itchy, but more a bothersome, not so much a cough, but a bothersome itchy throat. And just as Troy said, kind of like sinus infection type of symptoms. That's what I've been hearing more about with the new variant. So, and then there are some that are undetectable, or they're not even they don't show signs or symptoms, but just with a possible check, they've been finding they're positive.
Yeah, most of the asymptomatic people that are coming in, they're only coming in and testing because they are they've been exposed to someone who tested positive, or someone who was exposed and then had symptoms right afterwards. So, but it's still, just because you don't have symptoms does not mean that you're not contagious, and does not mean that it's not affecting you, and in some way, because some of the studies that are coming out are indicating that even those people who don't have symptoms, it's actually causing some, challenges and maybe sometimes damage to your organs. So make sure you pay attention um, to even a regular positive test with no symptoms, because it still could be a little bit of a problem for you. Phyllis, the answer to that is yes and no. We have some tests. We have some tests that we have that are available, but we don't have a lot of tests available because they've been, they either were used up or they have expired. When we were trying to give out test kits in the past to try to get people to use them, a lot of folks were not taking them. And so we had a large supply that expired last week. So we had to get rid of them. So our supply is low. We're waiting on additional tests to come in, but we do have some available, just not a lot. So this is a very confusing chart, I'm sure, when people look at it. But it gives a little bit of a, don't pay attention to dosage or anything like that. We're just looking at what's available for which ages. And so for Moderna, anyone who's interested in Moderna, you are eligible to, if you're 6 months to 5 years old, you can get a dose. You get 2 doses of the Moderna vaccine for that population. And it's the same for Pfizer, the age group 6 months to 4 years old. But for Pfizer, it's actually 3 full doses. When I say full doses, meaning you have to have 3 doses. It's not the same dosage as what an adult would get. In fact, the pediatric doses for people who are under the age of 5, it's about a third of what an adult dose would be. So you're not getting a full dose. So that's not something to be concerned about, that the children, the small ones, are getting extremely high doses of this vaccine. They're actually getting extremely low doses of this vaccine. But with Moderna, it's still 2 doses, just like everyone else. You take 1 dose, and then 4 weeks later, you take a second dose. And so also with Moderna, anybody over the age of 18, most individuals over the age of 18 can get 3 to 4 doses. So if you had your primary series and you have not gotten your first booster, I think everyone is eligible for the first booster. But if you're over the age of 50, you can get a 4th booster. Sorry, a second booster or a 4th dose. See how confusing it can get. With Pfizer, they actually also have it available for 5 to 11-year-olds. It's a primary series, just like everybody else, 1 dose. And then after 3 weeks, 21 days, you can get a second dose. And then you can also technically eligible for boosters after 5 months. In Pfizer, 12 to 17 is the same exact numbers, same exact series. And then Pfizer also has an 18 and older where you can get up to 4 doses or 2 boosters. So very confusing. But the question that you should have is, do you think it's been over 5 months since you've had your last dose? If it has, you might want to contact your primary care provider and find out if you're eligible to get an additional dose of the vaccine. Because if it's been more than 5 months, then your immunities are definitely decreased in most people. And so eligibility to get an additional booster dose is there. Just remember, if you're immunocompromised, you can actually get more doses than the regular standard population. So just make sure you ask your doctor about vaccinations and boosters to make sure that you're up to date. Because the new definitions are fully vaccinated is the primary series, which is the first 2 doses. Up to date means that you are up to date with any booster that you're eligible for. So when people say fully vaccinated, Fully vaccinated only means the primary series, based on the CDC's definitions. So, if you are you only had your first 2 doses, and the last dose you got was in 2021, you're probably due for a booster. So you can either call us here at the Health and Human Services Department. You can call the COVID response hotline 505-252-5986, and talk to one of our team members, and we will help you uh, figure out if it's something that you need to consider contacting your provider for, or calling the Santa Fe Service Unit COVID um, hotline to get questions answered. But as these numbers in the community and the numbers in the state continue to rise, if you have not gotten to the point where you're up to date with your vaccinations for COVID, you might want to consider checking into it to make sure that um, you are up to date. We are in conversation with the Department of Health to bring a vaccination clinic here on site, which will include the pediatric doses for those young ones between the ages of 6 and 5, depending on which vaccine that they bring, whether it's Pfizer or Moderna. But also anybody else who's going to need a booster, or if they have not even gotten their primary series, that will be available also. So keep your ears out for that, because it is coming as soon as we figure out how many people are eligible or are interested in getting the vaccine here on site, because it will depend upon how many we have that are interested. So again, the COVID hotline, if you want to contact one of our team members to let them know you're interested in getting the COVID vaccine, we can kind of compile a list. If you are not going to rush down to IHS or to the Department of Health or to Walgreens or Walmart or wherever to get your vaccine, we will be planning to have a vaccination clinic here on site. And usually after we give them a call and let them know that we're prepared for it, they will set it up within the next 2 weeks and get it here. So let us know if you're interested. If you have family members that are interested, if you have people you're concerned about who are immunocompromised or have medical conditions that you're concerned about, talk to them and see if they are interested in getting their additional doses. And we can set up a list and get the Department of Health out here to get the vaccinations done. So I know that's probably as clear as mud, because there's so many vaccines that are available for so many different people. But that's the reason why we say call us, and we can have a personal conversation with you, or you can call the IHS hotline and have a conversation with them, and they can guide you through the process. Yes, Phyllis, it can. In fact, so the question is, if you've had COVID recently, can you still get a booster? In fact, they are recommending that you get a booster, because the best protection that you can have is both a vaccination, booster, and prior infection. So if you have had a prior infection for COVID and you finally test negative and it clears out of your system, and then you get a booster within, usually within 90 days afterwards, the protection that you have from natural immunity and from vaccination is actually better than either prior infection or vaccination by itself. So yes, it can help. There is no guarantee that because of all the mutations that have happened from the original strain of COVID, which many of the vaccines are based on, there isn't a guarantee that it's going to stop you from getting COVID, but it will most certainly prevent you from getting extremely ill from COVID. It also helps to reduce the viral load, which means how much virus that you carry in your system. If you have a vaccination and a booster, you don't get as sick because you aren't carrying as much virus, which means you're also a little less infectious to folks around you. So there is some benefit to getting a booster if you had COVID recently. In fact, that's what they're recommending. Right after you test negative, make a call, make an appointment, go get your booster. It'll help. All right. Anything else from anyone else before we go to Health and Human Services updates? We are trying to navigate this most recent spike as best as possible. We want to make sure that the community understands that we are here for you, no matter what the circumstances are or what the situation is around COVID. If you just have questions, or if you need to have a conversation about COVID, or things you might be uncertain about, or maybe even have anxiety about, call us. We can talk you through it. We can, get you connected to people who might be able to help you. Because one of the things that we are not focusing a lot on is the emotional and mental well-being of the community during this pandemic. And those individuals who have tested positive, or who have family members that are tested positive, or are having anxiety around COVID in general, most of the folks out there don't know that there's help out there. There are people that you can call and talk to that can actually help you navigate these anxieties and these feelings of depression around COVID. Um, there are resources. I don't have the page that I can put up right this second, but if you need to contact us or contact me directly, I can talk to you about a resource that you can contact and get some emotional and psychological or mental support around this whole pandemic, because it is something that we're not always talking about. We're always talking about the physical aspects of COVID, and not necessarily talking about the emotional aspects and the mental aspects of COVID. So I do want to make sure that people understand that it is important to address that, because once this pandemic is over, we don't want to have a bunch of people who did not have any supports at all around the anxieties of COVID, the fears around COVID, the issues related to social isolation, being stuck in your house or feeling like you can't go out in the public. It is important to address those things, because it can also, stress can lower your immunities, lower your immune system. And if you aren't addressing it through either exercise or eating well or getting good sleep, or even finding somebody you can talk to, it actually reduces your body's ability to fight off infection, whether it's COVID or any other infection. Stress is not a fun thing to deal with. So um, I I know it's not part of my job, but if folks are not aware, I am a licensed therapist. I do provide therapy for folks outside the Pueblo, and I am open to having a conversation with someone if you absolutely need it, to try to get you through a rough patch. But I also have friends and colleagues that I can refer you to, that you can get either therapy or just have a stress relieving conversation, or someone you can talk to get some ideas about how to address what you're feeling and what you're dealing with. So I wanted to put that out there, because it's very difficult for a lot of people to talk about topics of mental illness, psychological stress, stress related to COVID. And I wanted to make sure that it's something that we start talking about a lot more often, because we need to make it a common conversation, instead of just something that we just sweep under the rug, and nobody talks about. So I appreciate all of you guys who are logged in, and I'm going to turn it over to the rest of the team to talk about Health and Human Services updates. Who's first?
I guess I'll go first. Um, well, going back, you talked about mental health and some of the challenges. Um, just going back, I wanted to kind of talk about some of the things, you know, we go through, I guess, as individuals. I mean, we're people too, right? We have feelings, and we are challenged from day to day with work, and then as well as um, trying to express or work with what we carry, either from home, from family life, those types of things. And one of the things that I'm grateful for is working with a group of individuals here that, the walks we have. I walk with the groups here, and we have conversations, And it really helps me to express what I'm feeling, whether it's a day-to-day basis or a week-to-week basis. You know, we all have challenges. We all go through something, and we're able to express ourselves. But then again, it's kind of unpacking and then also regrounding ourselves. We have that social support from one another. And I'm talking about the ladies here. And then with, as well as yourself, Troy, we do our best to support one another. And if the community here is able to find some outlet that helps them, that would be great. But it's what I'm saying is that's what walks help me to do. If you can find a way of expressing yourself and letting out those feelings, that mental health, that mental stress. I know coming in the very first time to brand new to the community, it was a little bit scary. It was a little bit daunting for me because I just lost my father to COVID, and so I was pretty emotional, you know, through the whole process. But today I can talk about my father's passing. We're coming up on the 1 year mark, and the past few weeks have been challenging for me. And so I really am thankful for everyone here that I talk to. But I think I'm getting through, you know, the grieving process. But if anybody else goes through that, you know, we're here as well to talk to. We've all gone through life challenges, and we're all trying to move forward from the challenges of this pandemic. And being Native American and being a female of color, it makes it that much more difficult. So I just wanted to thank the ladies in that manner. Also, we don't have Rebecca. She was also someone we were able to gather information from as well. But together, I think we're a pretty strong team, and I just wanted to bring that up. We're here, we're people, we have feelings, so just remember that, and we can work together as Native people. We can get through this pandemic. That's all I want to say.
Thank you, LaDon. That's you know, it's a very difficult thing to be and show vulnerability in the presence of others. But I think, as we've talked about even last night during our conversation about mental health awareness, you know, one of the things that's going to help us to build and recover during and after COVID is having conversations and talking about these things that are difficult to discuss, talking about those topics that bring, you know, significant emotion to the table that have been uncomfortable in the past. And grief is one of those things. Mental health is one of those things. Just being vulnerable all by itself is something that we have a difficult time doing. And I'm not speaking, you know, as a Native person, I'm speaking as a human being. But I'm sure that in the Native community, it's difficult. It's a little more difficult there as well because you know, we have a hard time having those conversations. So I just wanted to thank you, LaDon, for, you know, showing that vulnerability and bringing that to the forefront and making that part of the conversation, because people need to know our vulnerability can be someone else's strength. So we need to pay attention to that. So thank you for that. And I wanted to, while we're on the topic of walking, because you talked about the walk, Claudia, you want to talk about our weekly walks that the public is available to come and join us on?
Good morning, everybody. Let me take a breath. LaDon, you got to me. But we all have to hang in there and support one another, you know, through what we go through. So Okay, on Tuesdays and Thursdays, we have the walking group from that meet at 8:15, and we walk for 30 minutes. And it's really nice to get out there. Lately, it's already been hot in the morning, but just walking and in that area is very nice. Also, listening to the birds and just being carefree out there and enjoying the walk. And I also wanted to announce that we're still taking applications for farmers market. It's still open. They haven't had a closing date. And also the cards will be coming in the mail to the individuals now this month in July. And then also we're having the blood pressure clinic at the governor's office on Wednesdays, the first and third Wednesday of each month. We're usually there from 8:30 to 9:30. I think that's about it. If I think of something, I'll get back on.
Thank you, Claudia. Victoria, you want to talk about the scheduled events coming up?
Yeah. There are a couple things that I have. I don't know if you community members had seen my little page in the bulletin. I don't know. And there is a little calendar. That way you can track your steps. Want to get everybody up and moving, and like we all said, come join us on Tuesdays and Thursday mornings for our walking. Just come out and hang out with us. And also, I had put an announcement for Santiago Day, hoping with cases that go down and that we'll have our, can you see, Santiago Day run. That'll be Monday, July 25th. So I'm pretty excited about it, but just hoping everything goes good. If not, we have a tentative date if it gets postponed. And let's see what else. I'm still doing a fitness assessment. So if anybody wants to come in, either get a gym membership or just to know your numbers. And I think that is it for now. Okay.
Thank you, Victoria. Raylene, I see you're on. Are you able to give any updates from diabetes program? She might be testing someone. So we'll come back to her. Lenora, you have anything to update on?
Good morning. No, not really. I just wanted to go ahead and give out my number in case anybody, needs to get a hold of me. The number is 455-4164 for the office, and the cell number is 699-0164.
For those who have yet to match the voice with the position, Lenora is our ICWA manager / family advocate, basically our social services arm of the Health and Human Services Department. I'm going to put her information in the chat. And if you need to have a conversation with her or talk to her about anything ICWA or family advocacy related, she's the person to contact. So let me make sure I put this in here correctly.
I could add to an update. So today, I will be reporting to the CDC Foundation about the progress that's been taking place really giving an update about the Pueblo of San Ildefonso. So some of the topics that I'm going to highlight are probably going to be around really my role as a tribal public health educator and all the events and activities that we've all participated in, like the Love Your Heart event, the nutrition demos, and then also some of the podcasts. I think we got a lot of interest from different groups and communities. The last podcast that we had was with the master gardener, and he really liked the idea that we provide information live, and we're able to give this information. So he wanted feedback on how to get started with kind of a channel to deliver information. And then also the CDC Foundation also wants to know how we're going about providing information and education online. So I'll be reporting and providing that to them today. So I'm nervous, but I'm also pretty excited because a lot has gone on in the short time that I've been here. We've been able to connect with a lot of faces, a lot of new agencies and groups. We're able to bring in Santa Fe County and their fire department. So I think that's really important in delivering messaging. So hopefully, we'll continue to move forward with disseminating information. That's all I have to share right now.
Yeah, thanks, LaDawn. Just so you all are familiar, LaDawn and Rebecca as well were assigned to San Ildefonso Pueblo it's through Aztec, but they are employees of the CDC Foundation. Rebecca was our public health nurse. She is no longer with us. She took a job someplace else because the contract that she was on was going to end soon. And LaDawn's contract was going to end as well, but we actually got good news that we're going to be able to keep her for a little bit longer, and hopefully for good if we play our cards right. But the work that she's done has been invaluable to what our mission and our vision are for the Health and Human Services Department, because one of the big focuses that we have is public education and providing information to the community that could be useful in helping to improve overall wellness and health, specifically around nutrition, which is one of LaDawn's expertise, and as well as just general public health knowledge. So in addition to her assignment to the COVID response team, her primary goal is to bring information to the Pueblo and to the community that is needed to help to address chronic health conditions and to prevent specific diseases amongst the population through education. So we appreciate her presence, and her ability to report to the CDC about what she's done here is actually a benefit to the community. Because it highlights the work that we've done for the time that she's been here. You've been here since December, right, LaDawn? So in the past six, nearly 7 months, she's been here providing this education and providing support for the COVID response team, being on call, and she got the first in-office positive test on her first day testing, which was pretty interesting because we've been testing all that time in office and didn't get any positive tests, and she's tested for the first time, and her first patient was positive. So she had a rude awakening to COVID testing here in the office. But we appreciate her presence and her work. And the fact that she's going to be able to highlight that is a blessing to not just to the department and the program, but to the community. So anyway, it is 11:58 p.m. The what the heck grant, huh? That's hilarious. We are down to the end of the hour. We generally go from 11 to noon. We are trying our best not to exceed that time frame because I know people can only endure so much of our voices and so much talking without wanting to fall asleep. Not to mention, it's lunchtime. So I wanted to do a roundtable really quickly and see if anyone else has anything to add in that last 2 minutes before we sign off. So, Claudia, do you have anything?
No, I don't. I just wanted to thank everybody that's watching today. Thank you very much. We're usually on every Thursdays at 11. So come and get the news from HHS. Thank you.
From the horse's mouth, not the rumors. LaDon, do you have anything?
No, I don't. Thank you.
Victoria?
No, I don't. Thank you.
Lenora?
No, I don't either. Thank you.
Raylene? Have you found yourself back to your office yet? Probably not. She's probably still busy. Oh, there she is. You have 1 minute to say something if you have anything to say. And she's frozen. There you are. You're muted. Can't hear you.
Hi.
There you are.
Good morning or good afternoon, San Ildefonso. My name is Raylene Martinez. I hope everybody's staying well, stay home and mask up.
Thank you. Well, on behalf of the Health and Human Services Department and the COVID response team, we would like to thank everyone who logged in to watch this live. If you have any questions that you either forget to ask or weren't able to ask during the live presentation, you can post it in the comments even after we log off, either on Facebook or YouTube, and we generally get back to folks if they have any questions that we need to respond to later. And if you're watching this after the fact, basically the recording, either on YouTube or Facebook later on, you can also add comments there and we get the notifications and we can respond to those as well. So on behalf of the team, we'd like to thank you, and it's 12 o'clock and we'll see you all next week. Have a good day.